Okay. Welcome again, and now we will be talking about certain important points which will help us to understand how these sprain, strains, and tendon injuries happen over a comprehensive period of time, which will help us to identify how we can assess and evaluate the cases that we have discussed in the class. And this will give you an insight for the assignment question number 2, how we can take it further, because the definition part of each and every concept behind the sprain, strain, and tendon injuries are going to be the same. But when it comes to the human biomechanism, the one thing that is strikingly a truth, if you ask me, are like if we say, with respect to one particular action of an individual, will always accompany and will have a difference of opinion or difference of measurement for a same individual. For an example, if you ask any individual who are like 20 kg or like 30 kg or even 100 kg, if you ask them to jump on a foot measurement system, let us say like a plantar pressure measurement system, the first time when they jump and they land on the foot measurement system, the force plate, which will give you maybe around 1200 newton meters of force, and that, let us consider that they have reached around 1300 peak force. But the same person, if they jump again and again, that particular pressure that has been extracted will not be the same. So that we need to keep it in mind when we assess any individual with respect to the injuries that is happening. So sprain versus strain, the core difference that I'll be giving you an insight about is, like in sprain, that injury will happen with respect to the ligaments, so the tough bands connecting bone to bone stabilization joints. So if you see, the common locations are for the sprain is ankles, knee, wrist, which are caused by sudden twist, fall, or awkward landing when we jump on certain floor, or like we jump on different surfaces. This might happen, which also results in joint instability. So this is very important when we need to focus on sprains. But when it comes to the strain, so injury to muscles or tendons, the tissue connecting muscles to bone, is the concept that behind strain. For an example, if you, I have seen it in one article which was been explained really good. So if an individual is asked to hold 5 kg weight with respect to any wrist they are comfortable with for like 5 minutes, they will start to have a pain after 5 minutes of still hanging towards it. And if you increase the time repeatedly, like once they complete the 5 minutes, if you ask them to hold it for 10 minutes, it becomes a very big problem for them to hold it, because the weight remains the same, but the muscle, when they go under any kind of strain with respect to the stress that has been given, if it is like continuous progressive manner, then the muscle become fatigue, and they will lose the tendency to hold weight, even if it is like minimalistic weights. Okay, so the first common location that they might have this strain is all about lower back, hamstring, calves. So these are all the vulnerable areas that they that the strain will always have an impact, and this is caused by overstretching, overuse, or sudden forceful contraction. So overuse is something like, especially which it is like achieved by the athletes when they train extensively, they might have this. And sudden forceful or like incident or accident that might happen with anybody. Last point is like it affects the muscle functions and the movement. So it's a typical factor with respect to the strain. So these are all the core differences that sprain and strain are going to have. So visualizing the injury, so this is like how the sprain and strain might have it. So the red areas are like the strains, and the areas which are like yellow in color are said to be like a sprain. And understanding where the injury occurs is crucial for a proper diagnosis and treatment. So ligaments stabilize joints between bones, while muscles and tendons work together to produce the movements. Now we come to the important part. This is the actual case that we need to focus on. So I'll go with one by one. So the tendon continuum from irritation to rupture. The first one is like tendonitis. So this is something like an inflammation of a tendon over use. From overuse, this happens and characterized by pain and tenderness around the affected area. So tendonitis is the case you would have seen it in a normal life. So now the next one is like partial tear, the portion of the tendon fiber damage which causes a pain, weakness and reduced function in the affected muscle. So this is like a tear which happens due to over usage of the particular muscle. Let us assume that a cricket player or like football player, it will be a very good example. So the football player has not played like a game in last 1 month due to vacation period, and suddenly when he comes back without warming up, if you ask them to play a 45 minutes game, it is like a overusage because the muscles have become stiffened since they was not in any kind of practices in the last 30 days of time, and there was no good proper exercises, and since he's in vacation he had good foods which will not be a part of his regimen. So obviously this will lead to partial tear which will damage the fibers. And then the tendinosis, so this is like a chronic degeneration without significant inflammation. So pain occur especially with activity and movement. Usually in this particular cases, if you consider it as like if they only engage them with any particular activity or any kind of mobility exercises, therapeutic exercise they undergo, then this will be in significant inflammation which could be seen in that particular cases. Only by that particular time the pain might arise in these kind of conditions. So if you see in the last three different problems, every problem arises only with respect to the individual characteristics. So if an athlete is getting involved into this kind of factors, might have these kind of problem. Even a normal individual, they are like they are not doing any kind of physical activity subjected to the work and other kind of structure, this also be a case that they will also face these kind of things. And also the last one is like rupture. This is like very common thing that you could see it in a most of the cases. So it is like complete tear which compares with the partial tear, so requiring immediate medical attention and often surgery. So results in significant pain and loss of function, because rupture is something like a open wound or even a closer wound. Only with respect to a sudden force on fall with breaking the inertia, then only the rupture might happen. And in this particular cases, the rupture could make it lead to open wound fractures or like a closed fracture. So in open wound fracture, usually if you see the bone come out, and the displacement will happen, and it needs surgery immediately. Otherwise that particular victim who was underwent that kind of accident might not able to mobilize his fractured area in the future of this. So if you see in the closed fracture, again it is kind of a place that again we need to put like efforts to find out exactly how the fracture has happened, and whether the fracture has happened in the bone, and what kind of fracture it is, and whether it is affecting the symbiont bone which is like connecting to that particular joint. Everything matters, and all these things gives you an insight about how the injury might happen, and give you some kind of input regarding this. So the case study we are going to see here is like this is about ACL tear, a ligament struggle which you are going to work out. So I'll just explain the case. You can start working it out, and tomorrow we will discuss in the class. So what is ACL? The anterior cruciate ligament, which is like a key stabilizer in the knee, preventing exercises forward movement of the tibia. So the common mechanism is like sudden stops, change in direction. So soccer or basketball, pivoting with placented or like planted foot or direct blows to the knee. So the pop. So many patients experience a distinct popping sound at the moment of the injury, followed by immediate swelling. So this is the case that you are going to work it out, and you can come with an answer for this. Is very simple case actually. You can connect it with any of the article which is available in the Elsevier, and come with an answer tomorrow. We will discuss in the classroom regarding this ACL tear. This is very important topic, but the cases which is given here is a simple one. So let's discuss tomorrow with respect to this. Thank you.